So I am a physician. I'm Dr. Kendra Outler. I am a licensed and boarded anesthesiologist. I have a background in public health prior to training in anesthesia. So during the pandemic, I decided that I had some thoughts back to my public health roots, and I want to share it. And so I created this digital platform that I thought was needed to fill that gap between what was being reported about Black health during the pandemic and where we would still be after the pandemic. That means dealing with a lot of chronic illnesses. And as an anesthesiologist, I deal with all specialists, so if it's cancer, I'm usually involved. If it's heart disease, if it's diabetes, these are things that as an anesthesiologist, I have to make some decisions about whether I can put a patient to sleep safely. So it's very, so talking about all aspects of health is something that I do on a regular basis. And I just added my public health expertise to it. It's always like we keep spinning this conversation on mental health. The opposite of mental health is mental illness. So obtaining optimal health, which would be health equity, trying to achieve this utopia where everybody has optimal health, is a struggle for Black communities because of the long historical challenges to getting, number one, healthcare. Number two, getting mental health care that is culturally competent. Only 2% of Black Americans are practitioners identify as Black American are in the American Society for Americans Sociological Society, right? So we don't have a lot of us in terms of numbers to provide care. Some of the other challenges that, the heaviest burdens of mental illness or lack of mental health in our communities, and in communities that have longstanding trauma, like gun violence, longstanding structural racism challenges, like where to get food, long-standing challenges like infrastructure, like transportation. And you can imagine that compiling all of that onto someone who is, struggling with their mental health tips them over. And we also have to think about there are longstanding challenges like maladaptive behaviors and our school systems where our kids sometimes can't get some of the developmental help they need. And then as they become mature adults, they lack some of the social skills needed to deal with stress. Absolutely. I think, I have to remind people that, this is my relationship with a patient is very intense in the sense that I have a time to meet them and then to say, to disarm them. If you are feeling tense about something, if I have let's say a Black American transgender patient, right? And they have a history of depression or anxiety, and I need to speak to them, speak to them and tell them about, going to sleep for surgery safely. There's a lot of what we call intersectionality there. It's not just that they're a member of one minority community, right? And so you have to, in that moment, gain trust, and talk to them as if they are, talk to them like a real human, say, not the doctor voice. The other thing that's so wonderful about anesthesia is that I do ECT therapy with a psychiatrist. So we take care of some of the severest patients where, I can see the effects of long-term stress, long-term struggles with mental health when it becomes diseased and so diseased that you become disabled. The anesthesiologist is right there with this, supporting the psychiatrist. So on a daily basis, I do deal with mental health struggles in my patients, and whether it's also through gun violence. We think about now in terms of gun violence, taking care of not just the patient that has been wounded, but what effect does that have on every person involved, okay? So if you have a husband that's shot, how does his wife feel? Or a young man or a young woman, what does that do to the family, okay? And then all of a sudden that their mental health is now at stake. So we call those centers are acute trauma centers, and they're becoming more popular where we're thinking of more of a holistic approach to taking care of gun victims and their families. Yeah, so I'm very proud of the work that we've done. I do public service announcements. One that I took on was gun violence because it's been increasing. So even last year, we've had some cases of gun violence. We had the UVA shooting. I've been involved with a March for Life for one of the young men that passed during that shooting that happened. That seemed to be one early sign that we were going to have more shootings in schools. Sometimes we think that, oh, well, this was a Black shooting of a Black kid to other Black kids. But what we have to realize is that this is an indicative of what could be happening in the society as a whole. So I did a video. We put it out there. It's on my Instagram right now. It'll be put up on the LinkedIn, and we encourage people to think about what gun violence does to our communities. So that's really the platform that I highlighted this year. Every year, Uzima is committed to highlighting some aspect of mental health or mental illness challenges. We, so next year, we're going to have a conversation more on some of the common illnesses. I have a friend that has a daughter with schizophrenia. She wants more information for families like her so that she doesn't feel alone. And I think a lot of Black families who may be struggling with depression or, attention deficit. Early on, Uzima interviewed my pediatric psychiatrist friend, Napoleon Higgins out of Houston. And that got a lot of reviews, and it's still up on the YouTube to talk about attention deficit disorder in children. So we have some good interviews with Black psychiatrists. The platform boasts conversations with Ron Bailey, who is the chairman of LSU Department of Psychiatry in New Orleans. He's the first Black psychiatrist that they've had in a major Black city like New Orleans in 35 years. And that's very impactful, and people need to know about him. People need to know that he is a premier writer on gun violence. And I've talked to him about his book. I've talked to him extensively about his work. And so we need to highlight, what Uzima does is highlight Black physicians who are doing leadership, are leaders in combating health disparities in Black communities. So I'm not the only author. I like to share my platform. I like to engage. I like to find out who is doing something in our community that is Black. And because I feel like we won't get called to the national spotlight media, right? So we have to make that space, and Black media sometimes does not give us that space, or maybe only one unique person or voice. So there's a piece as well. Yes, what else I do? I write reflections, my own editorials, which is really why I started Uzima. I wanted a voice. And so my niece was like, well, nobody's going to listen to you if you don't have a platform and a name. So I'm Dr. K. But, so part of the reflections was having to experience sibling grief. My brother passed in 2021. I was one of the last people to speak to him. I had to reflect too that I've had a friend die from mom being killed by gun violence. I reflect on a cousin being killed by gun violence, but I wrote and penned about the conversation about grief. And they have this thing, they call comparison grief. Psychologists have coined it. Comparison grief means that, you say that I lost my brother, and then someone said, well, that person lost their child. People say it meaning to comfort or say they can relate, but sometimes it indicates some type of comparison. And grief is grief. I mean, you miss that person, whether it's your 80-something-year-old grandmother to a child. So we want to support and recognize every person's loss, but we have to be conscious of this phenomenon to have a comparison. So I miss my brother dearly. It's very painful to reflect. This is actually the month and the time that we buried him. To have that experience is tough. It's tough realizing that you got to kind of put one foot on the ground, put your clothes on, go to work, have a pause, go cry in the bathroom and come back out. I know what that's like, and it's intense. Well, I want to add that, our numbers for Black communities are rising in suicidal thoughts in our children. We are, through the Mental Health of America and even with CDC publishing, is that we are seeing an uptake that is very real. And I think that communities need to, across America, address what is going on with our youth. 13 to 18-year-olds are noting that they are having more suicidal thoughts. Most of the data right now is before the pandemic. We are still collecting, your CDCs and other entities are still collecting this data. But this is a real upward trend. Are we, as Black communities, the same as the mainstream or white numbers? No, but our communities are under siege and underfunded when it comes to mental health help, okay? And so that makes our disease process, or, the struggle with mental illness more intense. Right. And then you add that to drug abuse. We do have higher numbers of cannabis use, higher numbers of illicit drug use, which makes mental health, less achievable. It makes therapy less effective. So there are some real opportunities for grassroots organizations. I consider Uzima to be a grassroots organization to roll up our sleeves and work with our communities, whether it be the church, whether it be youth sports, to help spread the message that we need to enforce, we need to help our youth engage in better activities so that they can have mental health, so that mental health can be preserved.